Do you know how fast your VA healthcare can disappear without a single phone call, letter, or warning? One day you're covered, scheduling appointments, picking up prescriptions, and the next, you walk into your local VA clinic and they tell you you're no longer in the system. You ask why, and no one has an answer. Just blank stares, confusing policies, and advice to try reapplying. For veterans who served their country and followed the rules, it feels like a gut punch. And the worst part? This is happening more often than anyone wants to admit. Across the country, thousands of veterans are being quietly dropped from VA healthcare. No scandal, no headlines, just silently removed during a routine review or caught in the middle of a policy change they were never told about. Some are told it's their fault. Others are told nothing at all. And by the time they find out, they've already lost access to the care they depend on. If you've ever trusted that the VA would always be there for you, or if you're worried about losing your benefits without warning, then you need to hear what's really happening behind closed doors. Because today, we're revealing the hidden reasons why so many veterans are being dropped from VA healthcare, and why almost no one is talking about it. What you'll hear might shock you, but it could also save your coverage. Let's get into it. It usually starts with something small, a missed appointment, a delayed address update, or a letter that never arrived. For many veterans, that's all it takes to trigger a chain reaction they never see coming. What they don't know is that the VA conducts regular eligibility reviews, often behind the scenes. And if your information doesn't match up, or if you miss a step, they can flag your account for closure without ever picking up the phone. Some veterans don't even realize they've been dropped until they try to refill a prescription or book a doctor's visit. That's when they get the message. You're no longer enrolled in VA healthcare. No warning, no explanation, just a closed door. One veteran, a Marine who served 2 tours overseas, shared how he found out. He went to his usual VA pharmacy only to be told his coverage had expired. He hadn't moved, hadn't missed any income filings, hadn't even changed his phone number, but somewhere in the system, his file got flagged, and he was cut off. It turns out even small administrative errors, like a mismatched income report or a failure to respond to a single piece of mail, can trigger automatic removal. And once you're dropped, getting back in isn't easy. Many vets are told to reapply from scratch, complete new means tests, or wait months just to be seen again. This isn't about fraud or misconduct. It's about a system that's automated, confusing, and at times, shockingly unforgiving. And if you think someone will personally reach out to explain it to you, think again. Most veterans only learn the truth when they're already out. But this is just one piece of a much bigger and more unsettling story. For many veterans, the confusion begins with something that seems harmless: an income update. Each year, the VA requires certain veterans to verify their financial status through a process called a means test. It's meant to determine who qualifies for cost-free care and who doesn't. But here's the problem. If that information isn't received on time, or if it contains even minor inconsistencies, the system can automatically assume you're no longer eligible. One Army veteran in his 60s shared how a simple tax filing delay triggered his removal. He'd always filed on time, but that year, due to a personal emergency, he was a few weeks late. When he finally went to schedule a routine checkup, he was told his VA coverage had lapsed. No warning letter, no phone call, just gone. The VA later told him he'd failed to meet income verification requirements, even though he was still under the threshold. This isn't rare. In fact, veterans who earn just a little more than the national income limit can suddenly find themselves bumped into a different priority group or dropped altogether. The line between eligibility and denial is razor thin. And once you cross it, it can feel like the system stops seeing you. To make matters worse, the rules aren't always clear. The income threshold varies depending on where you live, how many dependents you have, and what kind of care you need. But the VA rarely spells this out in simple language. Most vets aren't even sure when they need to report changes or how those changes might affect their benefits. And here's the kicker. Some veterans are being dropped not because of actual income changes, but because the VA system couldn't verify their data through IRS records or didn't receive documentation in time. So even if nothing changed on your end, a glitch in the system could be enough to shut the door on your care. But income isn't the only reason veterans are being cut out. There's another factor that's even more frustrating. Another hidden reason veterans are losing their VA health care? Missed appointments. It sounds simple, even innocent. But 1 or 2 no-shows can quietly trigger a chain reaction that leads to full removal from the system. And most vets have no idea it's even happening until it's too late. Take the case of a Marine Corps veteran who missed 2 appointments during a rough winter. The roads were icy, he didn't feel safe driving, and he figured rescheduling would be no problem. But when he finally got around to calling back, he was met with something unexpected. You've been administratively discharged from VA care due to missed appointments. No prior warning, no second chance. Just gone. The VA calls this a loss to follow-up, a term buried deep in policy documents. Essentially, if you go too long without checking in, showing up, or using services, the system can flag you as inactive. And in some cases, this is used as justification to purge you from the enrollment rolls, especially if you weren't rated at 50% or higher or didn't have a service-connected condition that guarantees continued care. But what the VA doesn't tell you is that some facilities interpret this differently. In one region, a missed appointment might just trigger a reminder letter. In another, it could mean total removal unless you actively re-enroll. There's no consistency, and there's almost never an actual conversation with the veteran to ask, "Hey, what's going on?" This hits especially hard for vets dealing with mental health issues. Anxiety, depression, PTSD, these can make it incredibly hard to show up. And when the system penalizes those absences by cutting you off, it adds insult to injury. You're being punished for symptoms of the very conditions you're supposed to be getting help for. It's a quiet kind of betrayal. You served, you showed up when it counted. But the moment life gets complicated, the system disappears. And what happens next is even more infuriating. Another major reason veterans are being cut from VA healthcare, one that almost no one talks about, is administrative income mismatches. Sounds like a paperwork glitch, right? But it's quietly responsible for thousands of veterans losing access, often without warning, and sometimes without even understanding what went wrong. Here's how it happens. When you enroll in VA healthcare, your eligibility often hinges on your income, especially if you don't have a high service-connected disability rating. You fill out a financial assessment, and if your income falls below a certain threshold, you qualify for free or low-cost care. Sounds fair enough until the system starts double-checking your reported income with external databases like the IRS or Social Security. And if the numbers don't line up perfectly, the VA flags it. What makes this so dangerous is that these income reviews aren't always accurate. Maybe you had a one-time payment from a retirement fund. Maybe you filed jointly and the system counted your spouse's income as your own. Or maybe the VA system simply pulled outdated or incorrect records. In theory, you should get a letter explaining the discrepancy and giving you a chance to respond. In practice, many veterans say that letter never comes or arrives too late. One Gulf War vet reported being dropped after a discrepancy that turned out to be a $600 difference. He was never given a chance to clarify. Another Vietnam-era veteran didn't even realize he'd been removed until he tried to schedule an appointment and was told his enrollment was canceled for exceeding the income cap based on tax records from 2 years earlier. What's worse, re-enrolling after this kind of removal isn't easy. You often have to redo the entire process, including income verification, and in some cases, you may no longer qualify under newer thresholds. It feels less like a system designed to help and more like one searching for excuses to trim the rolls. These income checks might seem like harmless accounting, but for many vets, they become the trapdoor that drops them from care. And if you think that's as bad as it gets, wait until you see what happens when you're caught in a records error that isn't even your fault. Another reason veterans are being quietly dropped from VA healthcare, one that flies under the radar, is simple: outdated or incorrect personal records. It sounds harmless, but it can be devastating. A small error in your file, like a wrong address, an old phone number, or a misspelled name, can trigger a chain reaction that ends with your coverage being canceled without you even realizing it. Imagine this: a veteran moves to a new city, updates their address at the post office, maybe even notifies their primary care clinic. But somehow, the VA system doesn't sync the change across all departments. A crucial letter goes out, a request for updated income verification, or a notice that eligibility is being reviewed. But it gets sent to the old address. No response? The system flags the account as non-compliant, and just like that, you're out. One Iraq War veteran shared that he hadn't seen a single notice about his eligibility being in question. No phone call, no email, nothing. He found out he was dropped only after showing up to the VA pharmacy to refill a prescription he relied on, and was told his coverage had been terminated due to failure to respond to a mailed notice. A notice he never saw. It's even worse for homeless or transient veterans. If someone is moving from place to place, living with friends, or in shelters, their records are often out of sync. And without a stable address, those warnings and letters never arrive. The VA marks them as unresponsive and removes them from care entirely. There are also cases where veterans are mixed up with others in the system. A clerical error, two vets with the same name or social security number off by a digit, and suddenly the wrong person gets flagged. And by the time anyone figures it out, the damage is already done. The system assumes you're keeping up with their changes. But what if they're the ones who got it wrong? These quiet mistakes can have loud consequences, especially when you don't even know you've been dropped until it's too late. And yet, as bad as that sounds, there's one final reason that might be the most frustrating of all. Some veterans are being dropped, not because of anything they did, but because of shifting priorities inside the VA itself. One of the most unsettling realities for many veterans is that sometimes being dropped from VA healthcare isn't due to personal mistakes or paperwork errors. It's because of shifting priorities and resource constraints within the VA itself. Over recent years, budget cuts, staffing shortages, and policy changes have led the VA to tighten eligibility and reduce enrollment without clear communication. In some regions, the VA has quietly narrowed the criteria for who qualifies for care, especially in community-based programs and supplemental services. Veterans who once had access to specialized mental health care, rehabilitation, or chronic disease management might suddenly find those services reduced or unavailable. This means that even if you meet all the official requirements, your access can be limited based on where you live or the availability of staff. The impact is particularly harsh for veterans with complex or invisible disabilities, PTSD, traumatic brain injury, or chronic pain, conditions that require ongoing, nuanced care. Many have reported being told they no longer qualify for certain services, or that their benefits have been downgraded without a thorough review or explanation. Behind the scenes, there are whispers of program cuts aimed at cost-saving measures, pushing veterans toward private insurance or out-of-pocket options. While the VA claims these decisions are part of a broader effort to improve efficiency and redirect resources to the most critical cases, veterans often feel abandoned and confused. Worse, some veterans have encountered long delays when appealing these changes, facing months or even years without coverage while bureaucratic wheels turn. During this limbo, their health can deteriorate rapidly and the emotional toll compounds. This hidden reshaping of care eligibility can feel like a betrayal, especially after years of service and sacrifice. Veterans deserve transparency and fairness, but instead, many find themselves caught in a system that shifts the goalposts without warning. Understanding this bigger picture helps explain why so many veterans are dropped from VA healthcare without clear explanations. It's not always about individual fault, it's often about systemic changes that are rarely discussed openly but have profound effects on real lives. If you or someone you know is facing these challenges, it's crucial to stay informed, connect with veteran advocacy groups, and push for clarity from your local VA. Because in a system that's constantly evolving, your voice and vigilance can make all the difference. For many veterans, losing access to VA healthcare feels like losing a safety net, one they've relied on through some of the toughest times. But what's even more frustrating is the silence that often follows. When dropped from care, veterans frequently find themselves with no clear answers, no guidance on what to do next, and no one to turn to for support. This lack of communication isn't accidental. Some insiders suggest it's a deliberate tactic to avoid accountability, leaving veterans to navigate a confusing maze of phone calls, paperwork, and appeals on their own. The emotional toll is immense, feeling forgotten by the very system meant to protect and honor their service. Many veterans share stories of being bounced between departments, told to wait for a call that never comes, or given conflicting information that only adds to their frustration. The uncertainty breeds anxiety and distrust, making it harder to advocate for oneself or seek alternative care options. Adding to this struggle is the complexity of VA policies themselves. Eligibility rules can change without much public notice, and different facilities may interpret guidelines differently. What works in one state might not apply in another, creating a patchwork of care that feels unfair and inconsistent. Yet, despite these obstacles, countless veterans continue to fight back. They're joining forces with advocacy organizations, sharing their stories online, and demanding transparency and reform. These efforts are slowly shedding light on a problem that too many hoped would stay hidden. It's important to remember that being dropped from VA healthcare doesn't mean your service or health needs no longer matter. It means you might need to be even more proactive, learning your rights, connecting with support networks, and pushing for the care you deserve. If this sounds familiar, you're not alone. The system can be tough to navigate, but there are resources and communities ready to help. Don't hesitate to reach out, ask questions, and keep fighting for the health care you earned. Your voice is powerful, and together, veterans can create change that ensures no one feels left behind or unheard. Now that you've heard about why so many veterans are being dropped from VA healthcare without clear explanations, it's crucial to realize this isn't just a bureaucratic hiccup. It's a real issue impacting lives every day. If you or someone you know has faced this, remember that knowledge is power. Understanding the reasons behind these decisions and knowing your rights can make all the difference in fighting back and reclaiming the care you deserve. The system may feel overwhelming, but don't let frustration silence you. Reach out to veteran support groups, connect with advocates, and keep pushing for transparency. Your service earned you not only benefits, but respect and the care that should never be taken away without a clear and fair process. Thank you for spending your time with us today. We truly appreciate your attention and want to hear from you. Please leave a comment below sharing your experiences or any questions you might have. Your stories and feedback help build a stronger community and inspire others to stand up for their rights. If you found this video helpful, please like, subscribe, and hit the notification bell so you won't miss future content designed to inform and empower veterans. Your support means we can keep creating videos that shine a light on these important issues and bring you the information you need. Thanks again for watching, and we look forward to seeing you in the next video. Stay strong and keep standing up for what you deserve.